Of late, we are seeing a number of dengue cases rising, and we are seeing a lot of cases coming into the OPD, and more than the OPD cases, they are also requiring even admissions. Dengue is on the rise yet again. As we all know, dengue is one of the most fastest growing viral borne diseases, and it affects around 100 million patients annually. Literally, dengue translates into breakbone fever, which means that the kind of pain experienced by dengue patients is so severe that you feel as if your bones are breaking. There's a severe myalgia, you have a lot of joint pain, severe headache. It's like the worst headaches you might even have experienced in your whole life. You have a lot of pain behind the eye area, what we call as a retroorbital discomfort. Apart from this, we have a red color rash that can involve parts of the body, or it can involve the whole body in general. Photophobia is also a very common symptom. A lot of patients ask me, Doc, do we have to get worried about dengue? Is it critical? Is it life-threatening? And what do we need to know about it? Yes, dengue can get very critical. Dengue can be dangerous if not recognized at the right time and treated properly. What are our red flag signs? How do we know that this is something that cannot be avoided? Yes, if you are detected dengue positive, or if you are having fever, you're having all the symptoms that I just told, along with increased vomiting, continuous vomiting, or if you're experiencing sudden bloating in your abdomen, difficulty in breathing, or if you're having any kind of bleeding symptoms. You can bleed from the nose, you can have a subconjunctival bleed around the lower eyelid, or you can have vomiting which has some specks of blood, or they can be dark colored stools, or women experience increased bleeds like a menstrual bleeding. So all these are danger signs. If you experience giddiness, it can indicate that the patient's BP has gone down, and all these red flag signs I would I would encourage, or I would want you people to recognize these signs at the earliest and bring the patient or present to the hospital. Whenever dengue affects high-risk groups, so what are the high-risk groups that we need to focus on? If elderly population in pregnancy, infancy, or patients with diabetes or heart disease or any type of comorbid factors, if these set of patients are affected with dengue, they come under high-risk categories. So they don't have to be experiencing severe symptoms, but it's very important that they call for immediate medical help on getting dengue. How do we treat dengue? Dengue is treated on OPD basis if the patient is clinically stable, if there are no BP fluctuations, if the patient's appetite is normal, and the patient is treated on symptomatic basis. We give paracetamol, we encourage the patient to have a lot of fluids. In case the patient is not stable, say the BP is going down or the appetite is severely reduced, the pain is unbearable, there's continuous vomiting or some bleeding in any form, we advise urgent admission. On admission, they receive a lot of intravenous fluids, and if there is any secondary infection, they also need to be treated with IV antibiotics. And we keep a constant check on the blood pressure, on the pulse rate, on the abdominal girth, on the breathing pattern of the patient, and we watch out for any signs of bleeding. Platelet count has to be monitored on a very regular basis. In case the platelet count goes less than 20,000, we transfuse platelets. There are some situations where we have exceptions. If the patient is pregnant, then we transfuse around 50,000 itself, or if the patient is having severe bleeding tendency, then we transfuse early on. Let us know more about dengue so that we can fight against it, we can live with it amicably, and we can definitely overcome it. Take care, all of you.